As we age, our bodies undergo numerous changes. Our metabolism slows down, our organs don't function as efficiently, and our sensitivity to medications can increase. What worked for us in our younger years might not be as safe as we get older. Some medications can interact with prescriptions we're already taking, exacerbate existing health conditions, or cause serious side effects. In this video, we'll go through some of the most common over-the-counter medications that older adults should be cautious about and explain why these medications can be risky. Whether you're over 50 yourself or you're caring for an older loved one, this information is crucial. Let's get started. First up, let's talk about NSAIDs, or non-steroidal anti-inflammatory drugs. These include commonly used medications like ibuprofen, found in brands such as Advil and Motrin, and naproxen, found in Aleve. While they're great for pain relief and inflammation, they can cause gastrointestinal issues. This includes everything from mild stomach pain to more serious conditions like ulcers and stomach bleeding. As we age, the lining of our stomach becomes more fragile, making it more susceptible to the harmful effects of these drugs. Long-term use of these medications can also affect kidney function, potentially causing acute kidney injury or worsening chronic kidney disease, especially in older adults. Additionally, they can increase blood pressure and lead to fluid retention, exacerbating heart conditions, which is particularly risky for those with a history of heart disease or high blood pressure. Next, let's talk about first-generation antihistamines, such as diphenhydramine, commonly found in Benadryl. Diphenhydramine is also an ingredient in common over-the-counter sleep aids like Tylenol PM and Advil PM. One major concern is that they can cause significant drowsiness and sedation, which can lead to an increased risk of falls, especially in older adults. Falls are a major concern in this age group as they can lead to fractures, loss of independence, and increased mortality. They can also cause confusion and cognitive impairment. This is especially important for older adults as these drugs can increase the risk of dementia. Another issue is urinary retention. These antihistamines can make it difficult to urinate, which can be particularly troublesome for men with prostate issues. Additionally, they can cause dry mouth and dry eyes, which can be uncomfortable and lead to further complications, such as dental issues or eye infections. Second-generation antihistamines like loratadine, found in Claritin, are generally safer for older adults. These medications are less likely to cause drowsiness and have fewer side effects overall. Number 3. We have decongestants pseudoephedrine and phenylephrine. Pseudoephedrine is commonly found in Sudafed, and phenylephrine is found in many over-the-counter cold medications. Decongestants work by narrowing the blood vessels in your nasal passages, which helps to reduce swelling and congestion. While this can provide quick relief, decongestants can pose significant risks, especially for older adults. One of the main concerns with decongestants is they can raise blood pressure and cause an increased heart rate. This is particularly dangerous for people with hypertension or heart conditions. In addition to cardiovascular risks, decongestants can also cause insomnia and restlessness. They stimulate the nervous system, which can make it difficult to sleep and lead to feelings of anxiety or jitteriness. They can also interact with other medications you might be taking, especially those for heart disease, high blood pressure, or thyroid conditions. This can lead to dangerous side effects. For safer alternatives, consider using saline nasal sprays, which can help moisturize and clear your nasal passages without the risks associated with decongestants. Steam inhalation and use of humidifier can also help ease nasal congestion. We've made it halfway through our list, and we sincerely hope you're finding the information helpful. If you do, don't forget to tap the like button, subscribe to our channel, and turn all notifications on to stay updated with our latest health and nutrition videos. Next, let's discuss proton pump inhibitors, commonly known as PPIs. These include medications like omeprazole, found in Prilosec, esomeprazole, found in Nexium, and lansoprazole, found in Prevacid. PPIs are often used to treat conditions like acid reflux, GERD, and stomach ulcers by reducing the amount of acid your stomach produces. While over-the-counter PPIs are effective for managing these conditions, they are intended for use up to 2 weeks. Long-term use can pose significant risks, such as nutrient deficiencies. Stomach acid plays an important role in the digestion and absorption of essential nutrients like calcium, magnesium, and vitamin B12. Without adequate stomach acid, the body may struggle to properly absorb these vital nutrients. Calcium deficiency can lead to weakened bones and an increased risk of fractures. Magnesium deficiency can cause muscle cramps, irregular heartbeats, and even seizures in severe cases. Lack of vitamin B12 can cause anemia, nerve damage, and cognitive issues. Another significant concern is the increased risk of infections. By reducing stomach acid, PPIs can make it easier for harmful bacteria to survive in the stomach and intestines. This can lead to infections like Clostridium difficile, which can cause severe diarrhea and other intestinal issues. Next up, we have acetaminophen. Common brand name include Tylenol. While acetaminophen is generally considered safer for older adults compared to NSAIDs, it still requires caution. Too much acetaminophen can cause liver damage. In fact, acetaminophen overuse is the leading cause of liver failure, which can be fatal. Older adults with liver disease or those who drink alcohol should be particularly cautious before taking the pain reliever. Additionally, acetaminophen is found in many combination medications, such as cold and flu remedies, which can lead to accidental overdoses if you're not careful. It's crucial to read labels and ensure that the total daily dose of acetaminophen from all sources does not exceed the recommended limit, typically 3,000 to 4,000 milligrams per day for most adults. And lastly, we have oxybutinin. Over-the-counter oxybutinin, oxytrol for women, can be effective for overactive bladder. For men, the medicine still requires a prescription. It belongs to a class of medications called anticholinergics, which are linked to an increased risk of dementia among older people. It can also cause side effects like dizziness, dry mouth, constipation, and urinary retention. Thank you for joining us today as we explored the over-the-counter medications that people over 50 should approach with caution. We hope this information helps you make more informed decisions about your health and well-being. Remember, it's always crucial to read labels carefully, understand the potential risks, and consult with your healthcare provider before starting or continuing any medication. Thanks again for watching. Stay healthy, stay informed, and take care of yourself. We'll see you in the next video.